Tim. Yes, Driscoll.
Good morning. My name is Dr. Tim Driscoll. I'm a 4-year full-time resident of Naples now. I was a general dentist for 22 years in the western suburbs of Chicago, focusing on cosmetic, implant, and advanced reconstruction. Not only did I commit to more than 200 hours in continuing education annually, I lectured and performed over-the-shoulder training for licensed dentists. I began practicing in 1986, and by 1988, we were no longer recommending fluoride toothpaste, rinses, or in-office treatments to our patients. It was a known neurotoxin even back then, and we believed in informed consent for all of our patients. Patients could still request fluoride treatment or buy it over the counter by their own discretion. I was a founding member of the World Congress of Minimally Invasive Dentistry. The dental group met multiple times a year to discuss procedures and techniques we could use to prevent tooth loss. We found no change in the rate of carious lesions for our patients not using fluoride. In fact, with the advent of Cavo laser caries detectors in the year 2000, we found many hidden carious lesions in the deep fissures or on the occlusal or biting surfaces of teeth. Using water lasers or microinstruments to assess and access these decay areas, our dental members found that fluoride, although may have hardened the outer covering of the enamel of the tooth, carious lesions were found tunneling deep and narrow under the outer covering, causing more extensive and expensive restorative care for patients. Thus, the fluoride was masking early signs of decay, and only with lasers could we detect the deeper and more advanced decay. Furthermore, fluoride does not address the root cause of decay, which is a bacterial infection. Secondarily, decay increases with poor home care, poor eating habits, and medications or trauma that decrease saliva. Saliva is the body's #1 defense to decay. Thus, we chose to identify the cause of decay for each individual and resolve that issue, making fluoride irrelevant. Although it had been stated fluoride prevents decay, it does not. It can only decalcify tooth enamel. Decalcification of tooth structure is caused by bacterial infection. Fluoride does not eliminate decay causing bacteria. It only addresses the symptom, not the cause. Ironically, in-office concentrated fluoride treatments require no food or drink for 30 minutes after treatment because direct continuous contact with the tooth surface is required for stated effectiveness, and drinking would dilute the effects of intended treatment. So fluoride in the water supply does not ensure continuous contact. Actually, fluoridated community water makes no sense with the availability of over-the-counter or even prescribed fluoride products. Since fluoride does not eliminate decay and is a known neurotoxin, it is my recommendation to remove fluoride from our community water supply and let citizens make informed decisions for themselves and their family on the use or elimination of fluoride in their daily lives. Thank you for your time. Let's protect our brothers and sisters, especially pregnant women and young children. Thank you.
Thank you, Dr. Driscoll. Our